when infection is present, true detoxification is not possible. Can you go into why that is the case? Because I can understand in a very toxic environment, infection is possible. It's the case my father always brings up is you have a house with garbage all around, you're going to have pests, cockroaches, rats, whatever. As long as it's messy, it's going to have those. But go into the other way of seeing it, what detoxification and infection relation.
Yeah, great question. So I see chronic infections as really the wild card as to people's health. So let's talk about that. So when you have a chronic infection or even an acute infection, you have an inflammatory response around that. Okay. So you have pain, swelling, redness, and fever, right? Those are tools that the body uses, okay, in order to quarantine or break down or mobilize or save the body, get the immune system in there, get more blood flow, use temperature and, using fever. The body's very smart and knows what it's doing. But when you have these chronic infections, especially these infections in the mouth that don't hurt, okay, and that's the key thing is cavitation. I rarely do patients come in here and talk about cavitations as these are painful things. I'm usually the one saying we got a situation here based on what we see. But the chronic infections, you have an inflammatory response by design, okay? And when you have a chronic inflammatory response, it's going to create a acidity in the body. It's going to demand a lot of energy from the body. So, when you have that acidity and that demand for higher energy, we're also going to have you're going to have a pro-oxidant system that's kicked in. So, and detoxification and inflammation are actually opposites. So inflammation is an oxidant system and detoxification is an antioxidant system. Okay. And when you have this oxidant system being called upon all the time, that is going to depress the body's ability to detoxify, which is going to increase the body's toxicity because the body needs to detoxify all the time. But when it's being suppressed by a chronic infection and a chronic inflammation, then toxicity is just going to be going up. So I don't believe, now I'm just a dentist, okay, but I don't think detoxification, the time for detoxification is not when there's dental infections in the mouth. Mm-hmm. Okay. So the last bit of this is when you have chronic inflammation, oxidant system, depressed detoxification and increased toxicity as a result of that, which is the antioxidant system, you're going to have a lowered immune response with that as well. So you've got this vicious cycle going probably in two directions. And like I said, the wild card is getting the infections out of the body. And they happen to live mostly in the mouth because the jawbone especially the mandible. The mandible is a unique bone. It's kind of out and back as far as the blood supply and the blood supply and where it's different than other bones like that, and it's different. And the maxilla and the mandible are also different because they have these little white things sticking out, right? So it's the only place in our body where we have this gut wall that has been by design been penetrated by a tooth, and so that junction, that gap junction of the wet skin called the gut, is so important that we don't have a leaky gut there. Okay. And when we have these chronic underlying problems and these chronic inflammations that people are dealing with, these gap junctions are going to they're going to be stressed out, and we're going to have this leaky gut thing. And it really starts in the mouth because the mouth is kind of upstream from the entire gut system. That's this gateway to the mouth thing. And it's kind of like if you poison a stream way upstream, it kind of screws up the river. And the mouth is really the source of this. And the source is being the dead teeth, the root canals, the cavitations, like I said, that don't hurt, that dentists are not carefully looking at this problem, and cavitations in the old extraction sites. So the process of going through this is way outside the scope of just a dental experience, in my opinion. Like, you don't go to a dentist and get an abscess tooth pulled, otherwise, and involve the body in this process in biological medicine. Otherwise, you're going to be on antibiotics which kill the gut biome, which is hugely important. Okay. And you're going to possibly need pain pills. And I tell my patients, I don't use pain pills because I don't need them, because our patients don't hurt afterwards. And I'm strict about our protocol, how I take dead teeth out. I don't take them out one at a time. I don't take cavitations out one at a time, ever. That's breaking the law of biology. When there's death in the body wants it all out, not some of it out, all of it out in a safe experience. So protecting the body through the assault of the septic experience called getting a tooth pulled. And if there's another root canal somewhere else in the mouth, how is the body going to heal the wound that has just been created? Especially if there's been an open hole left there. Okay. I believe the ligament needs to come out. You need to reestablish that blood supply. I'm constantly looking for cavitations around dead teeth when I pull root canals, because they're there, because they can, because it's, dead teeth are off-gassing, creating all kinds of death around the bone around them. So we got to, dentistry has really got to take a close look at the current situation with dead teeth and how that's treated, and I prepare my patients well in advance of this experience. They come to Denver, they stay with us. We have a nursing, we have a medical clinic. They spend time with our nurses. We get colonics involved with ozone gas. We treat the gut system. We treat the extracellular matrix. This is really critical. We treat the what I call the inner ocean. Okay, you clean the ocean. This is where the cells are pooping in the body. You've got to make the ocean clean so that when the onslaught of removing the dental infections happens, and like I said, it happens all at once. And people are sometimes so afraid of it. It's like, well, isn't that too much? And I was like, no, it's the other way around. Mm-hmm. If you leave a little infection over there and you miss it, it's just like leaving a little fire over there to the fire department. Mm-hmm. Okay. We got trees surrounding us here in buildings. And I tell my patients, like, okay, if we got a grass fire and we got a forest fire, and we got a building on fire and a house on fire over there, do you think the fire department's going to show up and say, we're just not going to put that one out today because your insurance doesn't cover it. Mm-hmm. Or we're not going to put that one out today because you can't afford that. Disease doesn't care how much money you have. Okay. And this is why I'm training dentists right now. Okay. This is why we have the biodentist way. There's a methodology, a protocol that is a culmination of many years of studying, of like kind of doing it a certain way and then now doing it the way I do it now. And the reason why I'm strict in my protocols is because I tell my patients our goal is no pain and no swelling. And to wake up the next morning after a surgery like that and have your blood be cleaner than it's been in decades. So that now your body can take all that energy that was required to power that inflammatory response and power the detoxification systems in the body and power the immune system. Okay. All the energy that's required to manage. Now we've it's a rug pull. We pull the rug on the reason why the body has problems powering all these systems at the same time, unless you got a ton of energy. But anyway, this is the rug pull on the problem called, why am I so darn sick?
Right.
And and I look at how we do this now, and it's just such a beautiful thing, because I think people what they want is they want health sovereignty.
Yeah.
Right. And when there's all this sickness in the world and going on, people just want to be healthy and not have to go to doctors for their standard of care, disease control, disease care, ways of treating things and looking at things. So anyway, I'm sorry that might have been a long story, but
no.
I hope that answers your question on just really how this whole thing, how the mouth and the body are so intimately connected and so involved with each other that,
Absolutely. No, I mean, when I listen to this is truly a holistic and artistic interpretation of what dentistry should be. It is, the next step, I believe, where it needs to go and should be already at.